hello, who's joining? We're basically going to work through whole body cars. So I'm going to start with sort of upper body, and then Hallie and Cam will take over from there. Are you ready, Hallie?
I'm ready.
Yeah, so you can literally do it where you're seated, or if you want to find some space. I'm going to start on my knees. I just want you to imagine you're holding a ball in your hand, in each hand, and you're going to squeeze it as tight as you can, and then push your hands down towards the floor to create this space between your neck and your chin, so your shoulder and your chin. And then from here, you're going to turn to look at one shoulder, and then just roll the head down forwards as far as it will go comfortably to look at the other shoulder. Then turn to the side, and if you feel ready, you can go backwards. If not, just go back down, frontwards again until you do feel ready to go for a full circle. I'm going to start taking it back now. So back if that's comfortable for you, turn to the side. I'm just going to go one way 5 times, and then the other way 5 times. So just taking it, really trying to get that full range of motion. And just use this as a way to like check in with yourself today. You might not have non-crunchy neck right away. Might be a little bit stiff, especially if you've been at your computer for a little while. I've got one more to go this way, and just take it nice and slow. Then when you're ready, going the other way. So looking to the other shoulder, round. Keep pushing those hands down towards the floor. And keep that tension in your hands and the rest of your body. So also think about trying to keep your ribs pressed down too. So be careful that you're not just letting it all relax. So keep going nice and slow if you're going for your 5 the other way. Hopefully you can feel that gradually easing up with each rep. So I've got one more. Okay, let's start with the neck there. So next we're going to take that into scapular cars. So you're going to take your hands out in front of you, and I like to have mine just a little bit out diagonally like this. And we're just going to start with shrugging your shoulders up towards your ears and back down again. So up and down, just checking and see how that feels. And then when you're ready, we're going to take it forwards and backwards. So reaching away from you and then pulling the shoulder blades together, reach away and back again. And just do that a few times. And in a moment, we're going to join that all together. So if you're ready, what we're going to do is take the shoulders up to the ears, pull back behind, drop it down and reach away again. So a nice big circle. Might feel a little bit of crunchiness in the shoulders at the start. Hopefully that will ease up as we go. Let's go for, well, ideally it's as many reps as you need, but for today we'll go for numbers. So let's say 5 more of these, up, back, and down, and then we're going to take it the other way. So up, back, that's 3, 2, and 1. Now see if you can get it to go the other way. So take it up, push away, down. Bit hard to get your head around it at first after having gone the other way. Just see what control you have there. Hopefully get a little bit warmer into the shoulder joint, into the scapula. Let's go for one more. And then just let the arms hang down. We're going to go into shoulder cars next. So really important with this to make sure that you're not letting your back arch. So really press those ribs down, engage your core. Again, imagine you've got that ball in your hand that you're squeezing. I like to hold my hand on my ribs to make sure I'm staying honest with it. And then you're going to reach forwards, take your hand up as high as you can. Then just get the arm by your ears without arching. And then rotate away and then go back behind you. And then we're going to go back the other way. So you're going to reach as far back as you can, rotate round and back. And try and keep going with that. I just want to show you, try and be careful not to just rotate through your wrist. Try and turn your bicep away as you're rotating through the shoulder. Otherwise, you're just rotating your forearm. So let's go for 5, forwards and back. Then we'll do the other side. So reaching as far back as you can, up and around. And you can do the seated or standing, whatever feels right for you guys today. Rotate and back. Just really aim with each rep, just take it a little bit further. So we're not going quickly with this at all. In fact, I'm going to do one more. Rotate and back. And then we will do the other way. So switching to the other side. So squeeze that imaginary ball, reach away from you, up to your ear as far as it can go. Then turn the bicep away so the elbow crease away from you and back down. Reach as far back as you can and then take it around. So that's 1. Up, rotate, and then reach back. 2. Okay, 3 more to go before we work on the spine a little bit. And last 2. One more to go. So let's really make this the best one yet. So really reach up as far as you can, slowly rotating the joint back behind you. And again, reaching as high as you can, up and around. Okay, so moving on to our thoracic spine. So this it takes a little bit of body awareness. So you might not get it first time, but you will eventually. So I like to place my hands on my shoulders like this. You're going to tuck your chin in, and then you're going to turn, trying to keep both hips facing forwards, turn to face one side as far as you can go. And let's just start with that actually. So just twisting from side to side. Do that a few times just to get used to the feeling of that before we go into the full cars. So if you want to continue with that, you can. Otherwise, what you're going to do next is just going to twist to the side, and then you're going to turn, bend to the side, lift up, take it back and around. Nice and slow. I can see you're all doing this really well. Twist and back down. Good. And then twist again the other way. Tilt to the side. Take it back, making sure your lower back isn't arching. So keep those hips tucked under. Twist and back down. This is such a satisfying one to do. You should really feel it opening up as you go. So nice to see you guys all doing it. Normally on lives we don't get to see you guys. So this is good. Let's go for one more each way. In fact, I don't think I started with this side, so let's say one more after this one. On both sides, twisting to the side, slowly round, keep that chin tucked in, and those hips tucked under. Okay, hopefully feeling a bit more warm and ready for what we're doing today. I think Hallie's taking over next.
Oh, yeah, sorry.
Running away.
I've planned that. Oh, that's why it goes. Yeah. It's really hot here, so I was trying to like make the aircon a bit stronger, but apparently that's as far as it does.
Super warm then.
Anyway, we're moving on to the hips and then knees and ankles. So we're going to do quadruped hip cars. Knees underneath hips, hands underneath shoulders when you begin. And from here, we're going to start with going into hip flexion. So what you want to do is keep your core nicely engaged, and you don't want to go so far as you start tucking. So just think of the hips being level with each other, and you don't want the hips to tuck under, and you also don't want them to tuck, tilt side to side. So from here, into hip flexion, out to the side. Think of your little toe coming out to go up into that rotation, and then we end up in extension, coming back in. That's one, and we're going back the way. So a lot of concentration. It's actually really hard to talk through this. So nice and slowly, bring knee to chest. Sorry?
Can they see your screen?
I think so. Can everyone see my screen?
Yeah, I can see.
On speaker view. I think for some reason we're stuck on Kim. I don't know why.
Are you?
Yeah.
Oh, that's a treat for you.
And then back the way. Think of that little toe coming up as you go around. I think Callum's doing it on the column. Can you guys see that? Yeah.
Yeah.
Yeah, so like you can actually, when you're doing standing cars, you can hold on to something to use that block, because it's very easy, obviously, to compensate. So if you have a block, it will, going on to the next leg now. So we're going to do 2 forwards and back, nice and slowly. You'll notice the slower you go, the more you engage your hip rotators and hip extension muscles. One more on the way back. And we're going to move on to the knees. So knees should rotate about 10 degrees, which isn't very much, but until you start working on it, you don't realize it's a thing. Mine used to be really stiff. So before we go on to the full knee cars, can you see me okay there? I'm going to see if I can switch the screen so I can see where I'm at.
It's hard to see where we are, isn't it? To know
I can't.
Ourselves.
Hard on a laptop.
I don't know how to do that. All right, I'm just gonna. All right, I'll trust you. If you guys can see me, that's good. So from here, we're just going to basically bring the arm underneath your leg And you can hold onto your hand, but what I'd rather you do for now is put your hand on your shin so you can feel it rotate. So obviously like your foot will rotate with it, but it's very easy to just move the ankle instead. So think of the ankle being fixed in with your shin bone. And from here, we're going to rotate it side to side a few times, just to get you used to that feeling of rotating the shin. And to bring your shin out the way, think of the muscles right here. You could actually tap them to help engage. And then to bring it towards your midline, you can tap these here. So that should help. So once we've done a few of those, we're going to do 3 total rotations. So then you can grab your hand. We're going to rotate the foot away from you. When I say foot, I mean shin bone. Sorry, that's a really bad cue. Shin bone. Then you're going to straighten the leg. Don't worry if you can't completely straighten it. Then you're going to rotate the tibia towards the midline. And then we're going back into the middle. So foot pointing on the inside, shin bone pointing on the inside of your body, rotating out, and then back down. We're going to do 2 more of these. So rotating in the way, back down, continuing to rotate in the way, straighten the leg, rotate out the way, back down. Should be burning a little bit on the both sides of the top of the calf now. And don't worry if you can't like completely straighten, or if you get pains like on the Achilles or behind the knee. That's fairly normal to begin with. Okay, back to the other side, and we're going to just rotate side to side a few times. Get you used to that rotation. And this rotation helps you when you're in the squat, because you need a certain degree of rotation in order to get fully into the deep squat. Okay, so beginning by turning the shin bone out the way, straightening as much as you're comfy to, turning the shin bone in the way, and then down. So turning out, straightening, away from the body, and back down. So shin bone away from the body, straighten the leg, shin bone toward the midline of the body, back down. Going back the way, and then we're done with knees, moving on to ankles. So with the ankles, same setup. Ooh, what's happened there? Right, same setup, and we're going to rotate the foot. So instead of the shin bone moving, it's now your ankle you're trying to rest it. So we're going to rotate the foot out the way, try to draw a circle with your toes. So that's the easiest way I find. Okay. Some kind of sound coming up. Hold on. Keep going, guys. Don't do 3 each way. I think. Debbie, do you mind if I just mute you for a second? Because I think your sound is popping up.
Yes, I'm sorry.
No worries. I just don't know how to use this that well. Okay, I think that's good. Okay, cool.
Hit the arrow, Hallie, and look for us.
Arrow, this?
Yeah. And look for us and then click on it.
I am clicking, but oh, okay.
There we are. Much better.
Cool. Okay, now we can see what you guys can see. That took some time to figure out. Okay, cool. Callum, do you want to continue? Because I've got out of it now.
Okay.
Sorry.
So we'll move on to the next ankle. So as Hallie said, just use a hook grip under here. So hook your arm under your leg. Okay. Hold on to your shin just to make sure the rotation isn't coming from your shin, because we want to focus not on the knee like we did in the last exercise. We want to focus on the ankle. So to begin with, I'm just going to pull myself up into ankle dorsiflexion. So think about engaging these tibialis muscles on the front of your shin. Okay, and then what we're going to do is we're going to pronate slightly. Okay, so we're moving that little toe out to the side there, and then we're pushing the toes away from us. We're going down into plantar flexion, and then we're going to move over to the other side. So you can see I'm kind of drawing a circle over to the other side, and then from here I'm pulling my big toe back up, sticking to that side, up into ankle dorsiflexion and into the middle, all whilst engaging this muscle on the front of the shin here. So now we're going the opposite direction. So we're going that way, push the toe out, push the toe away from you. Okay, you'll feel the muscles now on the back of your shin, your calf muscles engaging here. Move over to the other side. Pull the toes up towards your shin and back into the middle. I'm going to go for 2 more of those full rotations. Out to the side, push away nice and controlled. Any painful points, just work around them. Might feel quite robotic at the beginning. That's absolutely fine. As you practice cars, they smooth out as you gain more control over the movement. And if you're doing it correctly, you should begin to feel all the muscles all up your lower leg engaging as you're doing that, and maybe in the feet as well, on top of the toes and on the soles of the feet.
Okay,
Cool.
that brings us on to this first subject. So the first subject is testing. And of course, that you can have as many cues as you like with squatting, but if you don't have the joint range of motion available, then the cues aren't going to help. So I've seen a bunch on the internet where people are saying, okay, well, why are the knees hurting when you're in a squat? And there's actual scientific articles somehow, well, they're not scientific articles, but they're like the big websites saying it could be the way that you're squatting, it could be your form, and it could be the fact that your heels are elevating and stuff like that. Well, you can't actually force the heels down if you don't have ankle dorsiflexion. So this is why Kim and I are now going to run you through some tests that you can learn how to do on your own. And we're also going to send you sheets afterwards so that you can have all the data on the tests. But basically, you should basically go through ankle and hip tests if you're going to want to have not painful knees. So knees are very important to test the ankles and hips, but it's also if you want to squat well. So we'll run you through a functional movement screen as well, but it's important to see this as well as the joint tests. And I think Kim's going to begin with big toe extension and ankle dorsiflexion.
Yes, of course. So how did you get your screen to be big? Because I probably want to do that for...
You just, you know where you've got the people displayed up the top?
Yeah.
Blue arrow, and you just
Oh,
slide it across.
yes.
Yeah.
Oh no, that didn't work.
Just click on it and then click on yourself.
Ah,
That's it.
okay.
Leave it like that, Harry.
Yeah, that's good.
Well, if I'm up on your screen, at least that's recording that way. Okay. All right, guys, we're going to get into big toe extension and ankle dorsiflexion. So to test that out, we'll start with big toe extension. Actually, I'll make sure you can see my feet on the floor. So ideally, to pass the big toe extension test, you want to be able to extend your toe up to about 70 degrees. So you can test yourself standing. See if you can push your toes into the floor and how high you can lift up one big toe at a time. If you don't have access to that at the moment and can't do it, you could also test by how you can pull your own toe up and see how high it will go with passively. But what we want to really see is what you can do actively. So see if you have got that range at the moment. I don't know how well you can see my toes on the screen. Can you see that okay, guys?
Yeah.
I don't know if you can't. Just trying to lift up, actually from the front. Pushing down and lifting up one toe. If you see how my toe is lifting up, maybe from the side there, as high as you can. And if you're really struggling to lift your toe up off the floor, then that's a sign in itself that that's an area for you to work on. Have a go at doing the other side as well. And like I said, if you are really struggling, you could go down onto the floor and just see how far you can actually lift your toe up. If you've got some passive range there, then you've got an area that you can work on to build strength with. I found Hallie and Callum's toe spacers are really good for just helping you to get more foot and toe awareness. That might be a good place to start if you are struggling with this at the moment. But there's plenty of other exercises that you can do as well. So if anyone is finding that they're struggling with this right now, we can always go through exercises for that. But I also wanted to tap into looking at the ankle dorsiflexion test and then how that comes in together. So if anyone's got a wall or something nearby, so I'm going to use this roller because it's here, you can use that to measure. You should be able to easily get your knee to touch wherever platform you're using without there being a problem. But we want to see how far you can actually get your knee to go over your toe whilst your heel is flat. So what I would then do, if most of our phones are generally around the right size, maybe a little bit over, put your phone against whatever platform that is, and maybe have your foot just on the inside of it there, and then just see how much range you can access, whether you can still get your knee to touch that surface or whether you are a little bit away or getting any pain or discomfort, because that's what we want to find out with these tests. Is it comfortable? Is there pain? what range have you got, and then we can go from there. So just have a little test. You might need to warm up into initially, but make sure that your heel is staying flat. Obviously, it won't count if your heel is lifting. So you can either do it this way or seated, like what Hallie is doing there. So have a check of the other side as well. And if you can get more than sort of a foam's width in there from lengthways, so you know that you're generally doing okay. I think the general recommendation is about 5 inches would be the optimal. If anyone is struggling, again, just let us know with that. In fact, it'd be interesting to know if anyone actually is. Have you had any questions come up at all, Hallie?
I have on email. So ankle dorsiflexion is quite a big one to be restricted, especially because nowadays most of our shoes have a slight heel. So over time, especially as we age, we just get tighter and tighter ankles.
Yeah.
Ankles also take the longest to adapt. So 3 months is really a minimum to start seeing changes, but you really want to be looking at being consistent with it for a year before you worry that it's not changing. So it takes a very, very long time. So it's something that you want to be doing 2 to 3 times a week if you do have issues with your ankle dorsiflexion. And that will mean things like isometrics, so like pails and rails. But you can also just do them in terms of reps to get your tibialis anterior stronger, and that's including your big toe. So we did have a question about bunions, saying, will bunions affect my knee pain? And of course that's true, it will, because it will restrict your big toe extension. So bunions affect your ability to extend your big toe. I think it's 70 degrees it should be able to extend. And with bunions, you're not going to get anywhere near that. And then, of course, you're going to end up with a limited strength in your tibialis anterior.
Yes, there's a question that's come in. When are you doing this test? Does it matter how your other leg is positioned? Do you want to show us? Was it? It just came off my screen. Was it Ellen who said that?
Yeah, Ellen said
Yeah.
Hi.
Hi. Got my helper with me. Yeah.
Yeah.
Hopefully you can see me over here.
Okay. Yes, it'd be really useful to do on real time.
So does it matter how this leg is? You know, do I need to be like?
It's what's more comfortable for you, essentially, to get into that position. How far is your knee going over? I can't quite see.
You're in the way, baby. I'm not quite there with either side, but my right leg is a little better.
Is it? Okay. It's getting over there. How was your toe extension test, your big toe?
It's all right. I can
Yeah.
lift it. I don't know if you can see it.
You've got control to.
Give me
Okay, that's pretty good. What about the other foot? Yeah. So generally, in terms of the testing, though, it looks like you would pass those tests. Do you find you struggle with getting your knees over your toes at all in squats?
I've always tried not to, so I'm working on it right now. It's more a mental thing than
Totally.
That's
thing.
The good thing is we're actually going to go over neurological tests afterwards. So first we're going to test all your joints related to the squat, and then we're going to do an overhead squat test and show you how that's related to neurological conditioning sometimes, because sometimes you can pass all the joint tests, but then when it comes to a functional movement screen, you can fail that. And that's simply because you've been taught a certain pattern or you've done a certain sport that has changed that pattern. And then we're going to go into how to help you with that as well. So I think, Ellen, with you, it's probably we're looking more at a neurological adaptation rather than a joint restriction, because you're very close. Yeah.
It's also worth mentioning that a lot of us, when we squat, we think about pushing our knees out the way.
Yeah, that was a cue that was told.
So when we do the ankle dorsiflexion, we've got a habit of pushing the knees out, and almost the knees are tracking over the outside of the foot. But what you actually want to do is just try to come a little bit more inward, so that your knee, as you're doing this dorsiflexion test, is tracking over your big toe and the toe next to it. Okay, just to get some true ankle dorsiflexion there. By all means, check what it's like from all angles, but as a standard, just straight over the toes. That's the best way to access your dorsiflexion and test it.
Cool. Does that answer your question? I think we had another one come in. Let's say, I agree with Ellen, ankle dorsiflexion is less when the other leg is on the floor and more when it's a lunge. Is that in terms of the position when whether you're seated down or lunging? Who was
That could also be to do with hips. So actually in the past, when I've tested some people's ankle dorsiflexion, it's from hip restrictions that they can't go down, or knee flexion restrictions. So knee flexion, for example, when you can't flex the knee too much, this can be painful for some people, and also having the hip this low. So in the past, I've had to test it this way rather than this way, because the hip and the knee simply won't do that. So there's another thing that we are going to go over, because it could be a combination.
Yeah, definitely. I think we've got to see this as a way to, we're sort of painting a bigger picture here. So this is just the start. Then once you kind of got all that information from this joint test, you can then look into it further and know what is needed there.
Debbie's asking, will the height of each individual affect the test? Because I'm really far away. There's a lot of people online that do say that limb height makes a difference, but I am skeptical as to the amount.
I think it would only make a big difference if your your feet were disproportionately sized compared to your shin.
Yeah,
but
Debbie, based off how I see you move, you're actually pretty good. You're progressing well.
When I do the foam roll and I put the phone, okay, my phone is pretty big, but like, it's like I'm really far away. I mean, I'm not even like, I feel like it's really far away. I feel my legs are short anyway. So I feel like maybe that, the portion of my legs from knee up is not long. So I feel like maybe that will affect it. I don't know.
A little.
To a certain degree,
to a certain degree,
yeah. There is
Okay.
something in it, but generally speaking.
Yeah, because I've also seen you do like knees over toe squats, and you do them pretty well. So I think it's a case of like maybe a little bit it will affect it, but also it could be because you're a little bit cold now. So like when I was first doing the test, now I felt tightness. I've been sitting this morning and I didn't really move into much range of motion yet today. So it could be that.
Yeah.
If we do a little bit more work on it, say later in the session, and then it's still not there, it could be a little bit of restriction that we need to still work on. Could be something that needs to.
So the goal is to reach the foam roller, I guess. Yeah. So
yeah, so you can also film it, and then we can also check the exact angle to be sure, because again, you're right, it could have slight differences when it comes to.
I think that will take me 3 years or 5 years.
Maybe not that long.
It's gonna take a long time. Yeah.
Okay. Oh, cool. Is there any more questions with that at all? Are we all happy with how we are with progressing with this? Everyone happy?
Callum will later also cover adaptations that you could do with a squat if you do have restriction in the ankles, because a lot of the questions that we did get in that people are going to rewatch are asking, should I only work on my ankle dorsiflexion in squats and have no heel elevation, or what should I do? And the answer is, of course, you want to do both. Like, you really do want to also add that elevation in so that you can access gains with your hips, because otherwise you're going to not be able to access that in the meantime. But you still continue working on your ankle dorsiflexion in the meantime. Right, so I think that's all the tests that Kim was going to go over, and now I'm going to go over hips.
Yes. Hope it all pieced together.
Yeah, hip tests are really nice and simple, but we can check them passively and actively. So for hip flexion, a nice test for squats will be a standing passive active test. So this is the difference between, is the camera okay then? I'm just going to pull it up so you can see a bit better. So it will be the difference between me standing here and pulling my knee up into hip flexion, and then letting go and seeing if I don't have a difference between that passive and active. A tiny difference is like, it's all right. But what you don't want to happen is that if there's a difference between passive and active and it's quite large, that's a big deal. Also, when you're going up into this, you want your back to stay straight rather than this happening. If you're tucking under, that means that when you go into a squat, it will tuck under as well. And although there's actually technically nothing wrong with butt wink, if it's an excessive degree, it could cause discomfort. And then you need to look into it.
Probably worth mentioning that you do that one up against a wall.
Ah, yeah, you could do it up against the wall. I never
Just
thought of doing that.
for balance. Yeah.
Oh, well, that's much more comfortable, isn't it? Sorry, guys. You could do it up against the wall for comfort.
Shape.
So you're doing it in a quadruped position. Like
Yeah, you can do it in a quadruped position as well. You're looking at 110 to 130 degrees. Although I love the fact that they, note degrees and stuff in courses, but the best way to know is by looking. So you want to probably just film yourself and then check. So yeah, the quadruped version would simply be same as the cars. You simply bring your knee up towards your chest. If you end up tucking, that's the point at which you would say it's a fail. So say I'm bringing my knee in and I'm tucking here. That means that I only have control up till this point, and then I tuck. So
and then
the true test result would be here.
And that's what's happening
Not
in
there.
a squat when you get butt wink. When
Yeah.
people are trying to go deeper than they should. So say her hip flexion's here, but she continues going deeper, you get this curving in the lower spine. So the best thing she wants to focus on, if her flexion is limited, then she'll do joint specific exercises to improve flexion, hip flexion. So
you can do that with pelvic rails. You can also do that simply with a standing kettlebell drill. I'm not going to use that, that's too heavy. But imagine you have a kettlebell on your foot, you can lean against the wall. I think Callum does this quite a lot in his posts. And you will keep everything neutral. You're going to keep control of your hips so that your hips don't tuck. And you're going to come up with the kettlebell several times, and then you can end up with an isometric at the end of your set. And that can help as well. So that could be something that you begin with before incorporating more intense pelvic rails. Okay, so next we are moving on to hip extension, I believe. And with hip extension, we're looking at 10 to 30 degrees. And the best way to really test this is quadruped, because it's easy to see. So if I keep everything neutral, hips in line, back neutral, and I'm bringing my knee up, and I get to my block. This is as far as I can go before I tuck my hips. So that's my true test result. If, say, you get here and it gets stuck, that's your true test result. Or if you start tilting, it's the moment you start tilting, and that is your true test result. So you're basically looking at full control, and you're aiming for your knee to be roughly in line with your hip when you're at this position. It's a lot harder to go backwards.
It's worth mentioning that the muscles, she's thinking about her muscles when she's doing this test. So as she's bringing that foot up behind her, she is engaging the glutes and the hamstrings in order to do it. So it's normal to feel like a contraction or a little bit of cramping going on in those muscles, but just make sure you are using them to get true results. Some people just lift their heel up and they're not thinking about the muscle connection.
Yeah, this is true. Some people aren't thinking, and then it just does that. Another thing that you could do is put a ball behind your knee, squeeze it, and then come up. That will help you engage and get a good test result. Again, if you fail the hip extension test, then it's a good idea to look at your hip extension isometrics, pelvic rails and stuff like that over the course of, say, 3 to 6 months to start changing your range of motion. And that would be a good idea to incorporate those 2 times a week. Hello. And then next, we are doing hip abduction, I think. No, next we're doing hip internal rotation. So hip internal rotation, we'll do both hip internal and external. So the confusing thing is the rotation of the hip is to do with the bone here rotating inside the hip socket. So it gets very confusing as to what is internal, external.
Yeah, come on.
So I'm just gonna lay down. Can you guys see? Yeah.
Yeah.
Knee in line with my hip. And so when my femur is rotating within the hip socket, internally, my foot is going outside, and that should, thanks
Nice,
Rex.
Good stretch.
So he's actually helping me stretch there. So I'm engaging the muscles here to do that, and that should hit 40 degrees as a pass. And then external, my foot's coming in the way, and it should be 45 degrees as a pass. And if you're compensating, this is going to be happening. The knee's going to be moving. Okay. The knee's going to be moving to compensate for you. So you need to make sure this is directly in line here. It's staying put. And that is your test. And the reason this is important is because you need a certain degree of hip rotation in order to access hip extension. And in order to get into your squat, you need your femurs to ever so slightly rotate. And and we'll go over the overhead squat test in a minute to explain to you how that might show up as a compensation. So okay, that's hip internal and external rotation done. Let me know, guys, if you have any questions on that. And then we're now doing hip abduction, which should be between 10 to 45 degrees. It's very different on a lot of people. And the best way I've been taught to test this is in a quadruped position, thinking of the hips as in line with each other. Like there's a spirit level here, so you can see if it goes side to side, and you can use a pen to test. So you could basically be here. Okay, Rex is sort of in the way. Here, bring the knee up, and then if there's a size of a pen between the floor and your knee, it's fine, roughly. I mean, that's what I was taught on several courses, and to be fair, as long as you can bring your knee up and you can see that angle get to 10 to 45 degrees and the hips do not tilt, that is fine. It is very rare for this to be a problem. If there's any pain, it's always worth noting. And later we're going to go over how the adductors are such an important part of the squat. So we'll go over that. But next is the overhead squat test. Trying to get through this quickly so I don't run out of time, because it's like an hour and a half, 2 hours, isn't it? So I'm going to use the edge of my mat to show you guys the overhead squat test. And there's different ways that you can fail this. So basically we're taking about a foot length-ish, a little bit more away. So basically a foot length, maybe you might add a little bit more than that, depends. And you'll have your feet about in line with your hips. Callum, could you move that screen? Or maybe
Yeah.
I'll move over here.
Maybe you should
actually.
stand
Here?
further back so I
Okay.
can see your whole body.
All right.
And then I'll adjust.
Can you guys see me?
1 second. Now they can.
Yeah, I can see you.
Okay.
And you probably want to do it.
I kind of want to do it
facing-
side on, really.
Okay.
Okay, I'm going to use the edge of this mat for you guys. I'm sorry, it's not visually perfect. But we're going to have our hands overhead, trying not to rib flare when you do this. And you're going to squat down, and you can do this in front of a wall if you like. So if you do about a foot length away from a wall, it's easier to tell because you're obviously going to hit the wall if you fail. So either your hands will hit or the upper body. So here you want to be able to get down into that squat with your arms up overhead. I'm going to do this side on for you, even though there's no cue. I mean, just imagine there's a line there. And you're basically squatting down. And the different ways that you can fail would be if, say, your knees do not let you go forward, you will fold forward. And if there's that wall there, you will hit the wall with your hands. Another way I see people fail this is the knees coming in and then people falling backwards. So this could mean that you have weak and tight adductors that are getting in your way.
And weak quads as well.
And weak quads, yeah. And another thing could be a lack of being able to use your ankle dorsiflexion, either neurologically or there's a joint restriction. And therefore, it's really, really hard for you to squat if you don't have that, which is why later we'll show you what you should do if you don't have that. But you can also test this wearing socks on a laminate floor to see if your feet turn out. So I'm not wearing socks and these mats are very sticky, but imagine you are, wearing socks on a laminate floor or a slidey floor. What might be happening is when you squat down, your feet might turn out, and that could be a compensation for a lack of hip rotation. So because your femurs are not rotating within the socket, what's happening is the feet are turning out to try to compensate. So a certain degree of this is fine. So if you have a little bit, it's not a big deal, but if they're going all the way out, that basically means you need to work on your hip, internal, external rotation to stop that happening.
Yeah.
Is that everything I was meant to go over? Let me check. Go through.
Question come in.
Question?
Yeah.
Did you say a foot as in 12 inches from the wall, or the length of your asking?
Length of your feet, so it's relevant relative to the person. Yeah. So yeah, it's basically if your joints lack range of motion, so like what we just showed you in the joint specific tests, then you need to work on them for sure. However, if you pass all the joint range of motion tests and then you do the overhead squat test and you fail, you know that that is actually a neurological thing. So it's something that you've been taught or a reaction to an injury or a sport that you've been doing. So I used to have this, I used to pass my ankle dorsiflexion test just fine, but because of ski training all my life, I could not do a squat, I would fall back. And this took me a while to learn. I think, Ellen, maybe that could be happening because you're passing the joint tests. Yeah, and when it comes to the overhead squat test, it's different. Pranav said, what if internal rotation is poor, but I can do the overhead squat? So yeah, let's have a look at your overhead squat. Let's see how it's going. Can you show us? Another thing is, guys, sometimes when you've got weight on a movement, it changes the way that your joints function. It's very strange. So sometimes going into it actively is not as easy as, say, having a weight and pushing yourself into it. Let's see. Okay. So if you'd like to try that one more time, are your feet completely straight forward, or are they rotating sideways?
Rotating a little bit, does that mean?
I can't hear.
It's a bit rotated, yeah.
Okay, try it again with your feet straight. I mean, honestly, that's kind of not bad.
Yes,
I mean, looks a little bit like you are touching the wall, but actually, if you, how little internal rotation do you have? Because is it just a little bit, or, because I haven't seen your internal rotation.
It's about 20-30 degrees, not more than that.
It's not too bad. I mean, that's only like, say you are 30 degrees, that's only 10 degrees off. Yeah, I'd say like with your squat, there's a little bit of compensation. So there's a little bit of tucking and a little bit of forward, not much. And that's the importance of doing the joint tests and the functional movement screens together, because sometimes the joint tests you can fail, but come to a functional movement, you're actually moving a lot better than what your active range is. All this means is that if we were to load up that squat, it might not, you might start compensating early on because you lack that little bit of internal rotation that can help you. So if you were to work on your internal rotation over the course of 3 to 6 months, your squat would also improve within 3 to 6 months, because you would get more control and you'll get more explosive strength, because these muscles are very much responsible for you to be able to control the squat, especially a deep squat. So the good thing is, I think it'll be quite easy for you to do that. Yeah.
Yeah, definitely. You'll have a great score once you've got that sorted, for sure.
Yeah, exactly. So that's the importance of checking them, because it means that you can basically go, okay, well, how do I make this really, really good now? Okay, I think, is that all the tests?
I think you've covered them all.
That's now moving on to Callum. So Callum's now going to...
I'm going to cover how you can adapt the squats to suit your current level of mobility. And yeah, that's the main thing. That's the main topic I'm going to cover.
If you guys have any questions in the meantime, just pop them over and me and Kim will check them out while Callum, while Callum's going over this section.
Cool. Okay, guys. So we did the movement test, and that gives you some key information on your current level of mobility. And if you failed a couple of those tests, that doesn't necessarily mean that you can't squat. That's a common misconception. Like, if you don't have the mobility to do it, then don't do the exercise. That's not the case, and that's not what I do. I teach you to adapt the exercise that can fit your current range of motion. So one of the best ways to increase your range of motion is by doing full depth squats. I'll give you an example. If you had a lack of ankle dorsiflexion, okay, which was limiting you from reaching a full range of motion squat, then what you could do, and this is what we quite often do with clients, is we'll use a heel raise, okay, or you can use like Olympic weightlifting shoes. But either way, you want to use a heel raise just to make the exercise a little bit easier for you. So you can see, maybe you can't get down into a full squat without the toes coming up, okay? So in this case, because that ankle dorsiflexion is limited, we might be able to keep the heels down on the wedge and still get a full range of motion squat. Okay, so we've just adapted the exercise so that we can still work ankle dorsiflexion, albeit not as much as if it was flat on the ground, but we can work on that on the side. Okay, that will be your mobility training on the side with joint specific exercises to improve, but we can also get the benefits of a squat using the adaptation. So you can see here, now I'm in triple flexion. So I'm working my ankle dorsiflexion, knee flexion, and hip flexion fully. Okay, so I'm building strength throughout my entire range. Even though the exercise is still, it's adapted, I'm still getting benefits from this. Another benefit of using this is it helps you to stay upright, which is another common problem that we see when people are squatting. They kind of fold forward, okay? And just having the wedge can help you stay a little bit upright throughout the movement. Also, by using this, even though your mobility is restricted, by using this adaptation, you can still strengthen your knees, your ankles, your hips, but you can build stronger quads and adductors. But just by using full range of motion squats, okay, you can still get the strength benefits of squatting with the adapted version.
Note is that the deeper your knee flexion, the deeper your squat, the more increase of the adductor group working. So when you go into a deep squat, the biggest increase in muscle activation is actually here. So it's not here or here like most people think. This is the biggest change.
When you're down in a deep squat here, the muscles that are going to be driving you up are your adductors, okay, your quads. So initially it's going to be pronation, so you're going to push through the inside of that. When you push up from a squat, you kind of pronate your ankles, and most of the weight comes through the big toe on the inside, okay? And the knees do come in slightly. Obviously, they don't want to come all the way in, but that's going to allow you to drive up, utilize your adductors and your quads on the way up until you reach this space here, which is essentially a hip hinge forwards. That's when the glutes kick in. So the primary muscles that we're working when we're doing a squat are the quads, the adductors, and the glutes. Okay, the hamstrings are involved, but it's not huge. Okay, so that's another reason to work full range of motion squats. Another thing to think about when you're doing this is the alignment of your spine as well. I say the alignment, making sure that you maintain a neutral spine, because you don't want to be squatting down flexed, but you don't want to overextend your back either. You want to make sure that you've got like a neutral position, so the spine, the shoulders and the hips are in alignment. And one of the best ways to do this is to think about the way that you're breathing when you're doing squats. So a breathing technique we use for squats is we inhale, fill up our diaphragm to create a radiation, as much tension as we can. So it will be at the top, and then we'll squat down, and then we'll exhale at the top as well. That means once we've taken that breath in, we've created all this tension throughout the body, and we can maintain it all the way down. And this is going to help you access more range of motion throughout your joints just by the simple fact that you're creating irradiation, tension at the top here, okay? And that allows you to activate when one muscle, irradiation, the law of irradiation is when you activate one muscle, all the other muscles follow suit. It's like dominoes. Okay, so you've got maximum irradiation throughout the body, helping you access greater range of motion. So breathing is a big, important thing when it comes to doing this. I'm just going to look at my notes, guys, and make sure that I'm covering everything. If you want to add anything to that, Ali.
Yeah, so basically an old cue, and I think this was like popularized by Kelly Starrett at one point, and I think at one point it was known to be true until some studies came out to debunk it. So an old cue would be to keep your feet perfectly straight and to push your knees out.
That's actually what I'm going to cover now.
Oh,
yeah. So,
continue.
yeah, so I know so many people that did this. I did it for years, okay? And that's how he just explained. When you squat, you may have heard this, screw your feet into the ground so that your knees externally rotate and push out. That's a popular cue. There's a lot of coaches using it, but it's not the correct way to squat. When we do this, we bias the hip external rotators. Okay, and you can see when you're down here in the bottom of the squat, look how far out my knees are. In the bottom of this squat here, look how far out my knees are. They're almost tracking right over my toe, my little toe.
I don't have a heel
here.
elevation. I'm going to try it. So it basically means my knees cannot go very far over my, like I'm now squatting back and I'm very much, it's just not comfortable.
What you're doing when you squat like this, okay, straight off the bat, you're limiting your ankle dorsiflexion. Ankle dorsiflexion, remember, can be accessed when the knees are in alignment with the middle toes. So tracking forward. So we need slight pronation in the ankles as well. Like ankle dorsiflexion, ankle pronation. That's what we need to get full dorsiflexion. If you're doing this, you're not going to get very far. You're going to be stuck. Try driving up from here. Okay, if we drive up from here with the knees out and try to push the knees out, I can't utilize, because my hips, because my adductors and my quads are in a stretched position, I can't utilize those. I'm using my outer glutes here and the hip external rotators. And what that does is it means I put stress on my lower back. So people end up pushing like this, up, out of it. Whereas what I was talking about at the beginning was, okay, so when I sit down in the bottom of a squat, I'm kind of sitting on the outside of my foot, but my knees are not out like this. Okay, so this would be the bottom of the squat for me. As I push up, like I said before, I'm thinking about driving through the big toes, so straight into ankle pronation. Okay, and you can see my knees as I come up, kind of come inwards a little bit, not excessively, but they come inwards a little bit. I can drive through my adductors, and then I can drive through my glutes to drive the movement up.
Something to
at
note.
the top. Yeah.
So this is all extremely important. However, if you lack, say, ankle dorsiflexion, that's why it's an important reason to use the wedge while you're going through the months and months of improving your ankle dorsiflexion, because you won't be able to access that. So when people say, oh, my knees hurt when I squat knees over toes, it could actually be a restriction in the ankles or the hips causing that, meaning that you're simply not capable yet of doing knees over toes without assistance.
And it could simply be that you're overthinking your squats and you're pushing your knees out and you're limiting your potential. You're limiting your ankle dorsiflexion. You're limiting the muscles that should be doing the exercise, should be doing the movement. They can't be utilized and used. Okay, so that's why cues matter. And there's so many bad cues out there. So I just wanted to bring this topic up, because if it's you and you're squatting like that, you will be limiting your results just through this simple cue, which is so easy to fix. Just to give you another example so that you guys can kind of grasp the concept a little bit more, is if I was to get you to externally rotate, okay, like that cue that they use, and you can feel these muscles engage. Now try and hinge, okay, and drive with your glutes. Your glutes are already engaged. You've hinged, you've inducted, you've engaged these outer glutes. Now you try and hinge and you drive forward. You can't utilize the glute maximus. It's not going to be strong. This is why when we do RDLs, okay, we've got the knees coming forward and we feel that stretch in the hamstrings. And on the way up, we drive through the glutes. Okay, you can't drive through the glutes if your knees are out. And that's why we don't teach you to hinge like this. And a squat is a hinge, okay? So when you're coming up out of that squat, you are hinging. So stop trying to push those knees out. Really simple.
Yeah.
I'll just check my notes to make sure I've not missed anything related to that. So maximum glute activation. Yeah, okay. So whilst all this is happening and you're building your squats up on the wedge, you will be working, as I said, on the side on improving your mobility. The idea is to get away from using the wedge, but you can progress this using goblet squats. Okay, so goblet squats is a really good exercise to get you away from the wedge, relying on the wedge. The reason being that we've got a kettlebell hand. Yeah. So first of all, with the wedge squats, you can progress them with the weight. Okay, so you can do goblet squats and use the weight to build strength. Okay, but if I was to just remove the wedge without any weight, this is a common thing people feel, just because they don't have that ankle dorsiflexion yet, you feel yourself falling back. That's a big problem. Like you remove the wedge, okay, and you try to squat full depth and you fall back just because you still don't have that ankle dorsiflexion yet. Okay, so maybe it's hip flexion, maybe it's hip extension, I don't know. Just an example, but what you can do then is you can use the goblet squats or any kind of front-loaded squat. The reason for this is by loading it on the front, okay, first of all, it acts as a counterbalance. So it's going to stop me from falling back. If I let go of this, I might fall back. But if I'm holding it out in front of me, it's counterbalancing me. It's allowing me to get down into a deep squat and I can still train the exercise, okay? Also, loading it up now with your feet flat on the ground and with the weight, the additional weight pulling you forward, you might notice that you actually can squat because of the additional load. See, we have passive range of motion, we have active range of motion. And one of the best ways to work your active range of motion is by loading an exercise. So just by loading this tissue up, maybe I can't do it with my body weight because I don't have enough weight to push me into ankle dorsiflexion, but now I do because I'm using the kettlebell. And I can now go down into a deep squat at my end range, and I can start strengthening it. I'm strengthening. Whenever you work exercises through the full range of motion in every joint, that's your mobility, or that's your flexibility that you're working. So that's a great way. Loading the exercise up is one of the best ways that you can improve, strengthen your range of motion.
Another thing to note, I've done this with people over years and years. So when you have one of these, you can start with your heel at the end here and then work your way down. So you can actually end up with your foot halfway on. And then next month, you can start with it a little bit further, so you're using less and less help, basically, as you load it.
You can, yeah, that's a good way to do it.
But there's a question here, well, I think is directed for you, Callum. So it says, so should the toes be slightly rotated out to keep knee in line with middle toes?
Well, everyone's different. Some people have the mobility in the hips and in the ankles. So you'll see it, there's such variation. What you don't want is your feet out like this. Okay, if your feet are out like this, like almost in a horse stance squat, that's not a good position to be in. Straight away, like I mentioned earlier, your adductors now are in a stretched position and you're biasing your glutes, the outside of your glutes, your external rotators, and you can't drive up out of a squat. So you just want to make sure that angle-wise, it can be straight on or it can be out like 30 degrees, but you don't want to go excessively. If you need to go excessively, it probably says something about maybe hip flexion, ankle dorsiflexion is limited there.
Yeah, so Michael noted something about it being much easier. I had a look.
Yeah.
It was much easier for him to squat this way.
Yep.
More flexibility.
Yeah.
Than this way. And I know this is something to do with ankle dorsiflexion for Michael, and therefore that's why we would suggest the wedge.
Yeah, but the minute, even though it's easier to squat with your feet all the way out like this, the minute you start loading this, you're putting yourself in a compromised position. Just because of the alignment of your, it's very difficult to keep your toes and your knees in alignment here. It's very difficult to use the muscles like the adductors and the quads in the way that we should be using them. So I would just advise if you're doing squats like this, then just try to bring the ankles in slightly, okay? There is deviations, you can go off to the side, but not too dramatically. That just means there's something there to work on.
Yeah, and I think with an addition of a little bit of a wedge, then there's a lot more that you can play around with, a lot more variations that you could do, as well as your sumo deadlifts and stuff like that. Yeah,
work on ankle pronation, ankle dorsiflexion, start improving that, and you will see. Yeah, you will see improvements in
it takes time. The ankles take the longest, guys, so that's the most frustrating thing. The ankles definitely take the longest, but
so I'm just going to show two more variations on that.
Okay, yeah, go ahead.
But yeah, so there's so many. We could do a whole new workshop actually on squat adaptations, because it all depends on the individual. Like I'll watch someone squat, or I'll watch their movement test, and I'll adapt the squat or the exercise to fit that individual. And sometimes you might not even get them squatting. That's not always the case. Mobility can be so poor that you have to use other exercises, maybe split lunges, or there's so many different variations. But another adaptation that we can make is we can use tempo squats. Okay, just to build more strength throughout your range of motion. You can still do this when you're on the wedge, and you can do it when you're doing goblet squats as well. Okay, so just changing the tempo around. Okay, to start, basically whichever position we're in, if we want to improve that position, we want time under tension in that position. The more time under tension we can spend there, the more improvements and more strength we're going to get out of it. So just going down into a squat and back up isn't always the best way to stay under tension in a position that you're weak in. If this is the case and you want to spend more time under tension, what we can do is tempo squats. We can use like 5 seconds lowering, working through that stage where you feel weak. Okay, and then when we get to the bottom, we can do a 5-second pause in the bottom position as well, and just start spending more time in the bottom of that squat, increasing the time under tension. Tempos can change, but I'm just giving you an example of 5 seconds lower in it. Okay, and then 5 seconds hold at the bottom. 5 seconds lower in, 5 seconds hold at the bottom. And you can also do isometric holds at the bottom, so you can go down into a squat. Okay, you can be holding the weight, And then what you'll do from here is you can see I've got full contact with my hamstrings and my calves. That's ideally what we want when we're in the bottom of a squat. Yeah, that's what we want. We want that full contact there, full range of motion. And then what we're going to do here is we're just going to come up like a centimetre out of that and strap them. Yeah. So I'm kind of in a relaxed position here, and then I'm just going to come up slightly out of that just so I can feel my muscles engaged, and I'm going to hold it there. Okay, and that would be an example of an isometric hold that you could do. You could do 5 seconds, relax a little bit, put the weight down, straighten up again, lift up, 5-second holds. It's all just utilizing that time under tension, getting comfortable and strong in positions that you're not already strong in. I think. Yep. I'm hot. Yeah, no, I covered like kind of what I wanted to cover.
Yeah. Okay.
Yeah.
Cool. I just need to see the sequence so that I don't. If you guys have any questions in the meantime, let us know. And I'm now going to move on to. Okay, so we wanted to cover pain points, and you guys, well, at least on Instagram, we got a massive list of stuff, and the main stuff that came up was knees and thoracic, so and low back. So what I'm going to show you guys is if, say, you have sore knees, of course, like I can't stress this enough, you have to look into your ankle dorsiflexion, and you have to look into your big toe extension, and you have to look into your hip mobility, because this is likely the cause of your knee issues. However, if, say, you are having knee pain and this has been a problem for a while and you want to start working on it immediately, and you are also working on your ankles, toes, and hips, then there's a way that you can work your knees directly to create more stability. So I'm going to use you as my pull. You can just basically grab a very, very light band, and you're going to pull it on the, I'm just going to move this so I don't end up standing on the laptop. You're going to get the band to pull your knee out the way, and you're going to stop basically the knee going out the way simply by stabilizing. So you're just going to do a lunge backwards. Now, if I was to let the band let me go sideways, I'll do that, and then I'm basically,
which is how a lot of people are queuing to squat at the moment, isn't it?
This is true. So this is actually very helpful. So when you use a band, this is called reactive neurological training, simply because this is giving your muscles a cue without you having to think of the cue yourself. So Kim is going to go through a bunch of that later as well. So say your knees are going out or in, you can use bands to stop you. So for instance, I'm going to do 10 of these, and I should start kicking in the stability muscles here. Likewise, if, say, my knee is tracking in the way too much. So say you are squatting and your knees are coming in. You use the band to pull you in the way. So you will naturally push out from the band. And
allowing the knee to track it over the middle of the toes, right?
And you can do this in all sorts of angles for knee pain, and it will help you basically kick in your knee stabilizers, which are all around the knee and in your hips. So yeah, that's one of the things that you could do, is start working RNT for the knees. Another thing is people having pain when the knees are going in different directions over the toes, or not being able to handle these positions, because of course a lot of our training is forwards, and it's forwards, and we don't do much else with these things. So of course you want to work on your knee cars, your rotation. However, if you stand in, say, this imaginary big clock, and you stand in the middle and you have a soft knee, you can actually start tapping with the other toe each dial on this imaginary clock, and you can see I'm not letting I'm not basically being strict with my knee. I'm letting the knee go in whatever position it needs to go into for me to touch these numbers on the clock. So I'm allowing my knee to basically strengthen in different positions. You can also do this on a wedge. So heel up, and then that will allow your knee to track a lot further forward and basically get you stronger in these positions you might find painful. So say you have pain in the knees going downhill, you have pain in the knees going downstairs, you want to strengthen this ability. Every time you go downstairs, this is what's going on anyway. So in order to be able to handle it, you need to practice it. But of course, that's not to say go into pain and force it. That's to say find that point that you can handle and work on that. And over the space of several weeks, months, this will increase and you'll be able to handle more knees over toes, basically. If there's any knee specific questions, just pop them into the comments. We'll cover them in more detail. What else was I supposed to go into? Yep, okay. I've basically covered that. So basically, guys, you want to look into ankle dorsiflexion, big toe extension, and hip mobility. Oh, thank you, Ellen, for joining.
Are you doing any joint specific exercises for those joints?
I'm
Oh,
going
you don't
to,
have time.
because of the time, I'm going to let Kim continue, and then
Yeah.
afterwards, I'm going to fill in with some more joint specific exercises.
Cool.
Sure. Okay. So then the other common pain point is lower back, upper back pain when squatting. So lower back, I think that mostly will come down to what your mobility is like. Again, like we said, in your ankles, your toes, your hips. That generally is, if you are restricted in those areas, that's where your lower back tends to compensate, especially if there is a bit of butt wink where your hips are tucking under. So everything we've talked about so far is what ideally you'd want to work on for that. And also what Callum mentioned in terms of bracing yourself using your breath when doing the squat. I think it's really important to understand that general core activation with your breath when squatting to help protect your lower back. I think with the thoracic, your upper spine, that's where you'll perhaps want to work on doing a bit of release work and working on improving that mobility you have in your upper back, and also strength work in your other sessions to strengthen the upper back muscles. We're going to do an RNT exercise, or I'll show you an RNT exercise in a moment of how you can train that neurologically. Otherwise, I struggle with words so much. Otherwise, if you were to do, say, a release using, you can use like a peanut ball, or if you've got two tennis balls that you could tape together, that would work quite well. And that's where you would literally just position it sort of the mid upper back there, and then you'd lie on the floor. In fact, I'll just show you. It's quite a good release, especially because I think a lot of people, and I don't know if it's the same for you guys, spend a lot of time working at the computer in this position, and that's just usually where we tend to get stiff in the upper back. So it's quite good to just mobilize yourself before training, not so that you're unstable, of course, we still want to make sure we have strength there, but you'll know what I mean when I show you this. So just placing it in that mid upper back there, and you're going to lie over it, and then just kind of let yourself relax over it, which won't feel very comfortable at first. You won't want to relax. Eventually, when you feel ready, you want to make sure you're engaging your core and then just pressing your ribs down to lift yourself up. You're just going up and down over the ball. And there's not really a set amount of reps that you need to do. It's really the amount that it takes for you to feel there's some kind of release there. You can even hold this position if you want to, but I would recommend moving through it. And you can also do this on if you had a foam roller. So you place it in a similar position. What you really want to make sure, and I should have said with the last exercise, make sure you're tucking your hips under and engaging your core to prevent your lower back from moving. You want it to all come through from the upper back. Now try and keep your chin tucked if you can. And then from here, you can have your hands on your shoulders and just see how far you can take it back over the roller. So you try not to extend your neck back, just testing that, and then coming up again and just getting it moving. It's also good to work rotation with your thoracic spine. So you could also twist from side to side. Just add this maybe as part of your warm-up, especially if you've had a long day sat at your desk. You're going to want to mobilize yourself before you go into any kind of lifting, especially squats. But that's how you could work through it there, and eventually you could extend that onto taking the arms overhead, keeping the hips tucked under, just trying to extend. So that's working on the thoracic extension there, and then this is the thoracic rotation. You could also do a really good exercise lying on your back, where you have both knees bent, feet on the floor, arms out to the side, and just let your knees track over. Try to keep the knees in a line, straight line from your hips, knees bent at 90 degrees, and just work on trying to reach back and twist. So if you're finding that you're getting stuck sort of around here, you probably are a little bit tight in your thoracic, so you'll want to work on these sort of exercises at first, and then eventually once your mobility improves with that, you then want to work on strengthening it, of course, as well. You can also do like trying to draw a semicircle as well, and just opening out there. So I think it's generally for if you're feeling a bit stiff after a long day, they're the sort of things you want to work on initially. And then the RNT exercise. So I don't know if you can see my band is linked up there. So I just want to be able to wrap your band around anything that's roughly, if I put myself through it, you want to be able to have it just sort of underneath your armpits, so if you can see from there. And this is just to help cue you to sort of use your muscles in your upper back to stay upright and not lean forwards, what should I say, overcompensate by leaning forwards or even arching the back. So just sort of make sure this band's not got super load of resistance, so don't rely on it fully. but just use it to help you to keep your back relatively upright as you track those knees forwards into your squat and back up again. Hallie's demonstrating that very nicely. And yeah, it just helps for you to get a feel of what it should be like, just like what Hallie showed you with the band for your knees, just practicing that upright. And I think it's all about building that mind to muscle connection. Once you know how this feels, you can then transfer that into the squat exercise as your mobility improves, as you get stronger with it. But yeah, generally, if you are experiencing back pain at all with squats, you want to look at the whole full picture of your body. Yeah, so they're the main ones that I was sort of looking into. Is there anything that you guys want to add into that?
I just wanted to add the overhead squat version. So this is brutally hard.
Yeah.
You need to have enough thoracic extension and shoulder flexion for this. But if you do have enough of that, then you can practice RNT squats with a band. Hold on to something fairly heavy. I don't know if that's heavy enough. I hope so.
I think it will be.
You can put it onto a pole. To be honest, that's probably safer. But I'm now going to, you can see me, basically go overhead and push the band over my head. Push the ribs down so I'm not doing any of that. And now when I squat, the band is trying to pull my arms forward. So I am engaging. This is a really great.
Try and go more overhead.
Sorry.
More up there.
Are you trying to talk to me?
That's it. That's it.
I'm doing this. Okay.
That's it.
I'll demonstrate and then talk. Okay, guys, I can't do both. Right, so yeah, when you're overhead, properly overhead, not like what I was doing, you should be able to talk, but also the point is if you say planning on doing overhead squats, that's a fantastic cue to help you learn the movement pattern for when you're loaded up here. Strangely enough, that is gonna feel harder than the actual overhead squat, so it's a good thing to do before. And then, yeah, so that was the last RNT drill I wanted to go through. And then we wanted to go through a few common areas that could be affecting your squat. So of course, hip internal, external rotation and hip flexion. So we're going to cover that first. And then if we have time, we'll do ankle dorsiflexion as well. So to begin with, where are my notes? So I'm going to show you my favorites. Of course, you want to be doing pels and rails for this ideally, but they are quite boring sometimes. And I simply prefer to get a good burn on these muscles. So sometimes I will do pels and rails. Sometimes I'll be lazy and do these, but they still work the same muscles and they still get them isometrically contracted. So for internal rotation, this is good for pranav. So you're going to be in a half frog position. So like this. Knee out to the side in line with your hip and foot out in line. So you guys can follow along if you like. And we're going to push the ribs down so we're not flaring or anything and we're not tilting the hips or anything like this. And think of your little toe spreading out. So think of actually splaying your toes as you do this. It does help just a touch. And we're going to go for 15 of these. So we're going to rotate as far as you possibly can. Think of these muscles here. If they're not kicking in, you can actually poke them a little to help. We're going to do 15 and then we're going to do a 10-second isometric at the end. And if you're really brutal, you can add a band or an ankle weight. But if you're really concentrating, this should kick in. I think we're on 6 now. 7.
I'll show you how you can do pelvic rows from this position.
Okay.
If you stay in position afterwards.
Can't wait. 5 more, guys. Should start kicking in about now. Should start getting that burn going. 2 more. And now we're holding at the top. Really, really try to increase that range now. Try to actually lift the heel even higher. Really focus on engaging. 5 more seconds. That should start burning up like crazy now. 3, 2, 1, and relax. So that, for me, is now burning up. I used to do these before squat sessions just to get my rotation to kick in more.
So that's a really good way to strengthen your, internal rotation, like Hallie's just demonstrated. I'm going to show you how you can, from the same position, I'm going to stretch how you can strengthen this position further at your end range to increase mobility in this movement. So I'm going to push her. So don't let your lower back, move, compensate. I'm going to push her into her end range of motion. So it's about here. She's fully stretched here. Okay. Usually what we would do here is a pels and rails. So we're doing isometrics. we'd hold this for about 2 minutes, a passive stretch. You can like use plates or a wall or something.
I've actually used a band for this, guys. So if you guys have a band or a belt available, you can put it around your foot and hold it here.
So once she's here, she's doing that 2 minutes. And then what we're going to do is we're just going to do contractions actually on both sides of the joint here. So
I can see a bunch of people just stood up to get the band. Let me just demonstrate what that would look like. It has to be quite a strong band, so I'm just going to show you guys where to put it, but Callum will actually hold my foot. So you just place it around your foot, pull it.
I mean, it needs to ideally be something that's it doesn't have resistance. Like it has a lot of resistance and doesn't bend. The band's not always the best, but it might work.
That actually works just fine. So if you just pull that there and hold it, what will work better is a belt.
Or you could do this in the 90-90 position as well for hip internal rotation.
You can, but I prefer this. You know why?
Why?
So the reason I prefer these kind of variations is because a lot of people in the 90-90 position, can I just demonstrate?
Yeah.
They complain to me that when they're here, they're uncomfortable on one side. So sometimes they're perfect here, they switch to the other side, and they're like, oh no, I can't get this. And then they have to move over and try to sort of wiggle their way around to find that stretch. And it can be very complicated. Whereas this is very simple. It's a very easy way to find your end range without compensating.
So what I'm going to cue her to do now is she's going to drive her heel down into, not her heel, her ankle into my hand as hard as she can. Okay, so she's kind of, her knee stays on the ground, nothing else moves. She stays contracted. And we're going to just go for 10 seconds, pushing down maximally, okay, for 10 seconds. And then she'll relax immediately. Now we're going to pull ourselves deeper into the stretch, essentially. So she's trying to pull away from my hand. So she's pulling this ankle up, okay, maximally contracting again, keeping the knee on the ground for 10 seconds, trying to get into that end range and strengthen it here. This is where she's weak. She's at her very end range of motion. We're trying to strengthen this area. She'll relax. Okay, and we'll basically just do that 2 more times. So it will be 10 seconds pushing down into my hand.
Yeah, yeah.
Yeah. 5, 4, 3, 2, 1. She's going to pull away for 5 seconds. 5, 4, 3, 2, 1. And then we're going to, again, 1 more time. She can actually, at this point, you don't have to go straight into it. Relax, Hallie. You can take a breath, okay, and you can pull yourself deeper into the stretch. And then you can go again for your last couple of, last 2 contractions. So pushing into my hand, 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Immediately pushing into this hand or pulling away from this hand. Keep going. 5, 4, 3, 2, 1. And then when you relax, you can hold it here for another 30 seconds if you want. Just get familiar in that position. More time under tension again. Yeah, but that's how she can strengthen that end range of motion.
Cool. Let's do the other side, guys. I've actually been to courses where we've just done one side.
Maybe
and I've been like really upset about it because we left feeling all wonky. So I'm not going to do that to you guys.
But the other side, let's demonstrate in the 90-90 position, just so they've got 2 options, because it's, you know what I mean?
Will that
still
be different or?
It still works, internal rotation. Just gives them 2 options.
Are you guys okay with that?
And the other does the other? Or I'll do 90, I'll do the frog or something.
Yeah, do you want to do the 90-90
Yeah.
internal rotation? And yeah.
Okay, let's do this. Still working the same muscles, guys, so it's okay. But
Just try to do the frog then.
Okay, yeah, so you do this version, Hallie.
Oh, what?
And Kim's just going to go through, she'll do the frog. They can watch that and do it, and you can teach it in this position.
Oh, okay,
Yeah.
right. So you guys have options, right? Okay, we're doing
Internal rotation, so into this one. Yeah.
Nope.
What leg are you doing? You trying to figure out
Yeah, I'm
which
just trying to figure out what leg's what. Hold on. Okay, all right, I've got this. Right, so usually we will do a passive stretch first.
Yeah.
Yeah, so once we're in the 90-90 position, if any of you guys are uncomfortable here and like say you're leaning over, you can sit on a yoga block to raise yourself, or you can actually lean to wherever it is that you feel more comfortable. As long as you feel a minor stretch, that's fine. So for me to find a minor stretch, I'm in the 90-90 position, rotating around and leaning towards this back leg. So now I can feel a stretch here, and I'm gonna basically sit here for 2 minutes. While we do that, if anyone wants to continue with the half butterfly version,
Oh, sorry. I'm going for
We're
it.
gonna do 15 reps with a 10-second hold on the other leg if you're doing that version. And we are doing the 90-90 version. So we're just basically sitting in this passive stretch. The main time passive stretches are handy is to get yourself used to a position, and then you want to work on it actively. I think we've got a question there. Are both hips supposed to be on the floor for the 90-90? Not really. It's kind of hard for this one to stay down. I'd say it's
Yeah, no, they
It's
won't.
just-
The main thing is that you've got 90 degrees here in this knee, 90 degrees there. This is in hip abduction, so if you're tight here and you haven't got good hip abduction, then like Hallie was saying, you might be forced over this way, but that's fine because you can still work it by, she can just put her hands behind her here, so she can still access that internal rotation. She'll feel that stretch in here, but yeah, it's just ways to adapt it depending on your ability, but
okay.
this hip isn't going to be on the ground. It's very difficult to get that flat on the floor.
Come
here. There we go. Yeah, you might as well do the contractions now.
Right,
2
okay.
minutes.
2 minutes. Right, so internal rotation pelvic rails, not my favorite, but they work. So we're going to push the ankle and the heel, the knee and the ankle down, and then we're going to pull the ankle and the knee up, thinking of actually raising the ankle first. So first we're going to push down. So 10 seconds pushing down. 9, 8, 7, 6, 5, 4, 3, 2, 1. Heel coming up. Obviously it won't come up if you're in that end stretch. 5, 4, 3, 2, 1. Immediately pushing down if you're comfy to. 5, 4, 3, 2, 1. Then heel and knee coming up. You'll notice this is kicking in now. 5, 4, 3, 2, 1. Immediately pushing down if you can. 5, 4, 3, 2, 1. Last one, pulling up. 5, 4, 3, 2, 1. And again, the same muscles
Stay
should
there.
have kicked in there.
Yeah, when she's working the muscles on both sides of the joint here, so when she's pushing down into the ground, she's working the muscles on this side. When she's pulling up, she's working the muscles on this side. When she's pulling up in hip internal rotation, that's when she's pulling herself deeper into internal rotation. They're the muscles that are contracting that are responsible for the internal rotation. So it's just worth noting that. Contract hard on this. Yeah.
Okay. Cool. Kim, if you're up for doing any exercises for ankle dorsiflexion or external rotation, we could still do that. Otherwise, we're moving on to the questions.
Yeah, should we do ankles?
Let's do it. Yeah.
Let's I might bring my computer down. Does that work so you can see it a bit better? So we're going to, you can pick whether you want to be in, well, that hasn't actually worked, you can't see me fully. When we did the ankle test earlier, it's a similar position. So if your hips were more comfortable in this position, you can start in that position, or if you're more comfortable sitting down, you can also do it this way as well. So what we're going to do is some pails and rails. I'll show you this way first of all. So you're just going to make sure your foot is flat into the ground and you're pressing your big toe and little toe down to the ground. Take your knee as far over as it will go. So if you've generally got good mobility in this position, you might be more comfortable here like Hallie is showing. And then what we're going to do is just spend some time here getting comfortable. You might feel a bit of a stretch up the back of the heel. And then what we're going to do in a moment is some contractions similar to what you've just done with the hip internal rotation. So not yet, but what you're going to do whilst the knee's tracking forwards and your heel is flat on the ground, you're going to push your toes into the floor like you're trying to push the ground away. That should create a contraction up the back of the leg. We'll do that for 10 seconds. And then you're going to try after that to lift the toes up towards your shin, and that's going to engage up the front, that tibialis anterior. You're going to hold that for 10 seconds whilst keeping the knee tracking forward. So I'm going to come down into this position now to do that because that's just more comfortable for me, but we can do this one together. So make sure your knees go over as far as it can, and then let's go for that first set of contractions. So pushing the toes down into the ground, 10 seconds. Should really feel that coming up into the back of the lower leg. Keep squeezing for 5, 3, 2, 1. And then now lifting the toes up towards the shin, which isn't very comfortable to do. Make sure that knee's still tracking forwards, especially if this is a difficult area of mobility for you. You will find this difficult, but it will get better. 3, 2, 1, and then pushing down into the ground. 10. So keep pushing down. Contraction up the back of the lower leg. 5, 3, 2, 1. It should be burning up now, lifting up the toes. 10. And 5, 3, 2, 1. One more round, pushing down for 10. 5, 3, 2, 1. Last time, lifting up the toes towards the shin. You're feeling nice and warm now. 5, 3, 2, 1. Relax, but stay in this position and just see how much better that movement may feel. See if it's your first time ever doing it, it might not feel that different, but over time it should really improve. I can definitely feel I can more comfortably get my knees over my toes now. So I definitely recommend working on this one regularly if you can. You could also do, if that was too much for you, or if you want to add it in, you can do sort of rocking gently over, and like what Callum showed earlier, you can try sort of the different areas of movement. If I show you from the front here, you can go more to the side. Obviously, you really want to focus on taking it directly over the front. Of course, we're going to do the other side now. So switching legs, I'll show you from this side. So whether you're starting in this position or kneeling down, let's just spend some time here and it stretch up into the back of the heel. Of course, let us know if you're getting any pain or discomfort whilst doing this. That isn't sort of the normal sort of burning up sensation that you should feel. If there is any pain, we need to know about that right away. So if you want to spend more time relaxing into this position first, of course you can. Otherwise, we're going to go into the contractions. Maybe just give it a little bit longer as we get used to this side. Okay, should we go for it now then? So we're going to push down for 10 seconds. So pushing the toes down for 10. That's it, keeping the heel flat on the floor, trying to track the knee forwards. Keep pushing down. 5, 3, 2, 1. And then lifting the toes up towards the shin. Keeping that heel pressed flat down. 5, 3, 2, 1. Round 2, pushing down into the ground, contraction up the back of the lower leg. 5, 3, 2, 1. Lifting the toes. And 5, 3, 2, 1. Last time, pushing down. 5, 3, 2, 1. Last time, lifting the toes up. See if you can keep tracking that knee over whilst the heel's staying flat. Keep lifting those toes. Last 5, 3, 2, 1. Ease off, but see if your knee can still track over. Maybe just hold a bit longer if you want it to stretch more, or you can have a go at doing the rocks gently forwards and back. Just go as a general rule, whatever feels best for you, as long as it's working on this area and your heel staying flat. That should have eased up a bit then. If you were to maybe practice your squat again and just see if what you've done has made much difference each time you come back to it, and then use it as a way to track your progress over time, which is why it's useful to take videos of where you're starting with and then progressing over time. But yeah, that's one of my favourite exercises to do. It's also good to look at how your ankle is moving in other ways, sort of eversion and inversion, so how it moves from here sort of sideways and then inwards, rotations like that. Often if you've had like an ankle sprain at some point, one of those sides might be a little bit tighter, which can actually also affect how well your ankle dorsiflexes. So good to be aware of that if you have any previous injuries, which usually is picked up on with a joint test. Yeah, was there any more that you wanted to add to that, Hallie?
A little bit of external rotation before testing the squat. Yeah. So you tested it perfectly there. So I think everyone would have had a nice little go. I mean, let's do a little bit of external rotation from the squat again, and then we'll go into questions and answers? Questions. The Q&A section. Right, so we're going to the last one, guys. We're going to be in a 90-90 position. And again, instead of doing pails and rails, because that's going to take ages, we're just going to do some quick activation. So instead, if you're comfortable here sitting upright, great. If not, you can lean forward a touch or even sit on a yoga block here. We're going to push our hands into the ground as we raise the entire front lower leg. But think as much as you can about your heel raising. So it's like you're trying to keep the knee down a little bit and the heel's coming up, but we're raising the whole leg, really focusing on the heel coming up. We're going to do 10 of these. So you'll notice straight away that the inside of your thigh is starting to burn up, and we're going to do on the 10th one a 5-second hold. So you should start feeling the rotation muscles kick in at that point. I've lost count, of course. We've got 3 to go. 2, and this is brutal. Now we're holding at the top. 5, 4, 3, 2, 1, and relax. That was horrible.
Yeah.
Just a bit of like torture for the end, you know? Save the best to last. So moving on to the other side. Oh, okay. All right then. Dog on my leg. I don't need that back leg anyway. All right, guys. So now that you're comfortable in the position, feel free to like stay here a little bit longer if you need to. Once you're comfy here, we're going to raise. So we're going 10 reps. 8, 7, 6, 5, 4, 3, 2, last one, 5 seconds. So 5, 4, 3, 2, 1, and relax. Sorry about that. That was cool.
Great way to finish.
All right, so now, after all that ankle dorsiflexion, internal, external rotation, have a little squat. See how your squat feels. Because we've technically done a little bit to help you into this position. Obviously, bear in mind that joint training takes months. So 3 months is a minimum. Your connective tissue is being worked, and that has much less blood flow, and there's a lot of neurological adaptations. So you're talking changes that will begin around 3 months, and you'll need really like 12 months to see major changes. So keep at it. But yeah.
Yeah. Does anyone want us to specifically check theirs, or any questions out now that we're at the end of that?
Let us know, guys. We're here to answer questions, and if you don't have any questions yet, feel free to think of them and send them over, or put your hand up and have a little chat with us. We've got a bunch here that were sent in. So we answer some of those first, unless anyone has anything.
Yeah, unless anyone, just let us know. Obviously, write it in the chat and we'll answer.
Okay. So someone asked, why is foot health so important to the squat?
Well, yeah, just like how everything, it paints that full picture. So if your foot health generally connects into your ankle dorsiflexion locks, obviously all the muscles around there connect one way or another. So if something's not moving well in one way, it will affect another area, and the same how that works up your leg as well. Is that question relating to like injuries as well, and how that can affect?
A bunch of questions related to the feet, so I guess we'll just interweave them. One of the major things is you'll notice when you're in a deep squat for a long time, your tibialis anterior will start burning. The front of your shin will start burning. And that's because that is helping you pull into dorsiflexion. So if you have poor big toe extension or poor dorsiflexion, this muscle is not going to be very strong or flexible, and therefore it's going to limit your squat a little bit. So that's pretty important.
It's also worth noting that
Debbie said, because you can't squat without your feet. This is true.
That is the most important.
nothing happens, especially with squats, like and movements of the joint, nothing happens in isolation. So like it's not just a case of like you need ankle dorsiflexion to be able to squat, you need ankle dorsiflexion, supination. Like there's a lot of movements going on inside the foot that you can't necessarily see. Like in a squat, it looks like it's just ankle dorsiflexion, but there's a lot more going on in there. And if one of those aren't moving, if one of them aren't working, it's going to affect the whole chain. And you're going to see that when you look at your form and you're not squatting right, or you're picking up injuries. So
another reason we haven't mentioned this, but obviously you guys will notice we're all barefoot. And I think all you guys are barefoot as well, but the reason for that, and even the reason for using toe spacers, is because it creates more space between your toes, and it allows you to grow muscle in places that has been atrophied for some time due to shoes. I don't think that squatting barefoot every time is something you have to do. However, I do think it's something you should do at least 50% of the time, because it allows you to then access more of your ankle dorsiflexion. It also allows you to access more biofeedback from the floor. So in order for us to move, we have to have feeling, right? And when our feet are squished in shoes all the time and we can't feel the ground properly, we can't respond to the ground. And therefore, especially if your feet are squished in and you're not getting all access to feeling, you're not getting access to all the muscles, your lower legs are not going to kick in as much, and that's going to kick its way up the chain to your hips and your spine. So over time, this can become a problem. Yeah. Whereas if you're actually using your feet fully, you're going to feel better and you're going to engage your muscles better over time.
Yeah, and that doesn't mean, like, we're not against using Olympic shoes. Like, I actually love squatting in like Olympic weightlifting shoes, or even using, like, you'll see them a slant board to do like bicycle squats.
Cyclist squats are amazing.
Cyclist squats, sorry. And yeah, the reason is because when you raise your heel, you're using a lot more of your quad, so the movement becomes a lot more quad dominant. So it's really good for building quad strength. So you just have to understand that there's reasons for why people are wearing Olympic shoes, or there's reasons to use them, but not to rely on them. Like, it doesn't make sense to be able to squat on a wedge or on a slant board or with Olympic shoes if you can't do it barefoot as well.
So the ultimate goal is to aim your way towards being able to have full ankle dorsiflexion and full foot function as well. Although there's nothing wrong with using aids in the meantime. Another thing I've noticed, like, so for example, my Olympic lifting shoes, I have stopped using recently because they are very narrow. I think there's some companies that are doing more wide ones, but this is something that I think is being talked about in the industry, the fact that most Olympic lifting shoes are very, very narrow at the toe base, which while I'm improving my foot function, this is a problem because I put those on and it really squishes my feet and it's making me uncomfortable. Therefore, I'm relying on a wedge instead to do those types of squats. So yeah, if your Olympic lifting shoes are really squishing your feet, maybe consider using wedges or slant boards.
Or wider shoes. I think, is it Innovate?
Yeah, I think they're doing
a wide toe box Olympic weightlifting shoes now.
Yeah, that'd be cool.
I think. Yeah.
And this relates to our other question. We had someone ask, I have bunions and I have knee pain. Is it possible my bunions are influencing my knee pain? And this is, of course, true, because bunions will affect your big toe extension, ankle dorsiflexion, and therefore it will affect your knee pain. And big toe extension, tibialis anterior weakness is a very big factor to knee pain, especially at the front and the bottom of the knee.
Yeah, this is why at the moment the tibialis trainers that you see, these things that you hook to your foot and popular. You do these curls here. That's why they're so popular, because with more and more people are starting to understand the importance of like the health of your ankles for your knees.
Also, just as a little snippet of, because we had a lot of knee pain questions and I know a lot of people haven't turned up live and going to rewatch, so I'm just going to cover it very quickly. But if you're getting knee pain, right, and the location of your knee pain matters. So if you're feeling knee pain here, it is most likely related to your sartorius TFL group, your hip flexor group here. It could be related to your adductors, but most likely it's to do with your hip flexors. Most people that have sort of snapping hip syndrome and pain here tend to have pain on the inside of their knee. Another thing is if you've got piriformis syndrome and sort of pain over here, you can have pain on the outside of the knee as well. You've got super tight quads or restriction in your hip extension, you could have pain at the top of the knee here. If you've got restrictions in your ankle dorsiflexion, big toe extension, you can have pain in the knee underneath here. So the location of your knee pain and pulling is very much to do with the muscles connecting in and tugging you when you are trying to go into knee flexion.
And it just comes down to being, the knee pain is just a byproduct of the lack of mobility, essentially, in the joint.
Yeah, and a lot of people say things like, oh, I've got damaged cartilage, I've got damaged knees. I have got a lot of gristling going on in here, a lot of damage from ski training, and it got to a point where I couldn't use my knees at all. But it was actually my terrible hip extension and issues with my feet that were causing problems, and also the fact that after my car accident, I lost a lot of muscle on one side of my body. But the point is, it was my hip and ankle function that was key to creating knee stability and a lack of pain, essentially. You can still hit my knees, but
yeah, you'll be surprised. A lot of knee pain or any pain that feels like it's in the joint usually does stem from something more muscular, and it will surprise you that, because I've had a lot of clients that will literally do these exercises and they'll be like, oh, the pain is gone. Like I thought it was something a lot more permanent. It's like, no, it's literally just working out the limitations of what you need to work on and starting that journey where you can, but until you know that, how would you know otherwise? So yeah, it's why you shouldn't always be concerned if you do feel certain pain that feels like it's like the end of the world, you'll never be able to move again. Usually movement is the answer, and working out what you can do for sure. So that's really helpful what you did there, Hallie, sort of painting a picture of where these muscles do pull into. It's useful for people to see that.
Yeah, it's a very visual thing because very much related to what's connecting in here. It's very, very rare to get an issue which requires surgery. You'd have to have a tear that is a clean tear, complete tear. If it's a partial tear, you still have a very good chance of rehabilitating that. Me and Kim and Callum have done that plenty of times with clients where there's a partial tear, they've been booked in for an operation, but you've got that window of helping them. And usually we've actually managed to stop them having surgery simply because we've worked on the weaknesses that they had. So yeah.
And sometimes surgery, like if you've completely torn your meniscus or something, you do need surgery. There are cases where you need it.
Yeah,
so we're not saying
no.
like do listen to your doctor, but
Of course.
During the prehab and the rehab process, make sure that you find a good coach to guide you through it, because it might be the case that your doctor's told you you need the surgery but you don't, or it might be a case of you get a really good coach, you have the surgery, and then you're back up and running in 6 weeks time, and you've got rid of the problem that caused the knee pain in the beginning. Because if you go ahead and get surgery and you don't do any rehab after it, what's going to stop it coming back? What caused it in the first place? It's all the issues we're talking about: ankle dorsiflexion, hip flexion, all of these things. So
so usually if it's a complete tear, there's not much you can do about that. That's something you can't do much about. But if it's a partial tear, you do have a choice, and it depends on the degree of it. So definitely get second opinions for that one. What other questions do we have? Do you guys have any questions that you'd like us to answer? Okay. This is an interesting question. So this one is, should I train hip or ankle and knee mobility for a certain amount of time before training squats, or would you recommend doing it simultaneously?
Simultaneously. I think we covered that, didn't we,
most of the time it will be simultaneously, unless you say have a very severe issue. So say you've got severe ankle dorsiflexion limitations, it would also be outside the session. So in the session and also outside the session.
If the way that you're squatting is like detrimental to your to your joints, then we'd stop that, and we wouldn't advise keep going. But usually you can adapt the exercise to suit you. It might look nothing like a regular squat, but you can adapt.
Generally speaking, a good bit of advice is, if you are in pain, have a personalized joint assessment, because sometimes this pain will need addressed outside of your other training. So for example, if say you're having some kind of very, very severe hip pain or back pain, you might want to actually adapt your training to that and make it more rehab focused, and separate the strength section to just rehab work, and then start blending it as you progress with your range of motion and your control.
Yeah, there's cases where people just can't move, isn't there?
Yeah.
And training takes on a whole different
route. Yeah, it is very dependent. But that is why test your joints, test your functional movement screens. If there's any pain, that's a good reason to look into it further. If it's just simply a mild restriction, then that's something to work on.
I think so. If anyone's got any other questions.
Yeah, if you guys have any other questions, let us know.
How many people are on here live right now?
Only us lot left.
Okay.
That's going to be a lot.
Can I ask a question?
Yeah.
About the squat, like obviously everything, you, Hallie and Callum, but for me personally, obviously ankles was a big thing, hips a big thing, but also I notice, you know, when I do the goblet squats, I find my upper spine is like has to work really hard and like burns to keep the weight in front of me.
Mhm.
That's the like I assume it's just it needs work, and I need to keep, you know, to improve my strength, obviously. But like sometimes I even get sore in the back here,
Yeah.
Yeah.
just
I mean-
from like
Well, like we're all still learning all the time, every day. So we don't- but because we personally train Debbie,
Yeah.
you know what the injury is here. I think this is actually relating to your arm injury.
Yeah.
I don't think this is a very common problem. That you can have problems with lower traps and lats kicking in too much.
Mhm.
But you're pointing more up here, aren't you?
Yeah, it's like
I think that's to do with
Is this when you're holding the weight in front of you?
yes.
yeah.
Yeah.
So when I'm holding it and I'm going into the
Yeah.
end of the squat, and I have to really like squeeze my spine to keep it. Otherwise, it's gonna go like this.
Yeah, that's
actually
pretty.
suggest-
I mean, that's pretty normal. Like when you do front-loaded squats, just make sure that your scapula are retracted and depressed. So
Mhm.
think about bringing your scapula back and down. It could just be an issue that maybe you don't have as much thoracic extension as you need, like Kim covered.
Which I
thoracic-
don't.
Yeah, Kim covered thoracic extension. Getting that thoracic extension, but without letting the ribs flare, is really hard. And the exercises that Kim and Hallie showed for R&D, reactive neuromuscular training, with the bands pulling you forward, is a great way to to work that thoracic. But it's
I
a problem
think
for a lot of people.
In this case, though, Debbie, because of your arm injury and because of everything you're working on, you're technically working on these things slowly. But
I know.
because of your injury, I think it's going to be a slow process. Therefore, what you could do in the meantime to stop that burning up and causing pain, you can actually hold the weight on your body. So if it's
Yeah,
like,
actually, I find it like this is easier for me to hold it.
like I used to actually hold the kettlebell upside down, so the handle here, and then rest the big part on my chest, so it's touching my body. So I didn't have to necessarily hold it up so much in the beginning.
That feels better. Yeah.
Yeah, that's good advice. I think also assessing like the weight that you're using. If you're comfortable with a lighter weight, maybe doing it that way and then gradually building the weight back up again. I know perhaps your lower body could do heavier, but if you're specifically training your upper back, maybe a little step back, or like Hallie said, that adjustment there, just to take the weight off a little bit so you can then train it back up.
There's no reason for you not to have it out in front of you at the moment. Like I would just literally make it easier for yourself.
You could also try a back squat as well. There's that option.
Yeah.
There's just
At the
I
moment, I don't think
suppose-
she's got the kit available.
Yeah,
So that's not
okay.
so easy.
yeah.
Or if you have
problems.
dumbbells, you can literally place them on your shoulders instead, on top. So
Yeah,
there's
there's
another
different
options
ways,
to
yeah.
load it differently.
All in good time. It takes time to fix things.
Yeah, exactly.
Yeah, that's the thing. Like if any kind of exercise is causing you pain, you can always just adapt it so that it doesn't do that anymore. Because you don't want exercise to cause you pain. That's no fun. But these things do change. I remember in the beginning when I used to front squat, and the hardest part for me in a front squat was my thoracic and my lat connection here. It was like seriously affected by my car accident, and it didn't even make sense. But legs, fine. This area, it was killing me. So
Yeah.
adaptations. Any other questions, guys?
Is there someone who? Someone said thank you.
Okay, cool.
Oh, I think we.
All right. Well, I do not know how we managed to actually make that on time.
I'm a bit like,
Yeah.
what do we do now?
There were points we were talking very, very fast. So I hope you guys got all of that. If there's anything that you want to see more of, let us know. I think we're going to be doing way more workshops in the future. And we're going to cover different types of topics. So this was kind of like our solo squat one, but I think there's a lot more we could go on about squats. I think you mentioned adaptation.
Yeah, I just was thinking, Debbie, when you do your front squat, are you doing the bracing technique where you breathe in at the top and hold it throughout? Just curious.
Probably not.
Okay, because
Probably not that much. Well,
Yeah,
not that
you
much.
don't have the air in your diaphragm. it's not going to be able to create stability. So that's just that could also make you come forward more. So think about that. Fill it up and hold it.
Yeah, I think my breath is small. It's not like that. Yeah.
Okay.
You're right.
Cool.
All right.
Yeah.
Well, yeah, we will probably be back in a few weeks with another one of these. And we'll cover more.
Yeah.
And it doesn't always have to be squat stuff. It can be other stuff. I think we're also going to be doing upper body things as well.
Yeah, if you guys let us know, like you're the biggest driver as to what we do. If you let us know what you need, any questions, then we'll know exactly what to do for you guys. This is really good fun though. I hope it's been useful.
Yeah.
We've enjoyed it. It's been good, hasn't it?
Oh, cool.
Yes, thank you for joining.
Okay, cool. Well, watch your inbox, guys, because I'm going to send you notes over from what we had. And then if you have any other questions in the meantime, just email us back and we will do our best to answer you. And we will be back in a few weeks with another one of these. And yeah, we'll also send you the replay, the recording.
Yeah.
Yeah.
Awesome. Thanks.
Thanks
Cool.
for joining, Michael, and thank you, Pranav and Debbie and everyone else that joined in and had to go. And then yeah, thank you for everyone that's going to rewatch it as well.
Right on.
Cool.
Okay, guys.
All right. Okay.
All right, see you later.
Bye.
Bye.
Have a nice day. Bye.
Bye.
Bye bye.